Escitalopram, better known by the brand name Lexapro, has helped millions of people find relief from depression and anxiety. By balancing certain brain chemicals, it can lift mood, reduce excessive worry, and restore a sense of stability in daily life. But like any medication, its benefits come with potential downsides. While some side effects are mild and fade with time, others can be more persistent or even serious, and knowing about them in advance can make all the difference. The truth is, not every reaction to Lexapro is talked about openly. Some people experience subtle changes they don't immediately connect to the medication, while others face more obvious symptoms that disrupt their quality of life. In this video, we'll uncover 7 side effects you might not expect, from physical symptoms that make daily tasks harder to mental changes that can alter how you feel and interact with the world. Understanding these possibilities isn't about causing fear. It's about being informed so you can act quickly if something feels off. If you're taking Lexapro or considering it, this information will help you work with your healthcare provider to stay safe while getting the most benefit from your treatment. 1. Persistent headaches. Headaches are one of the more common complaints among people starting Escitalopram, and while mild headaches may come and go without much concern, persistent or intense ones can be a real disruption. These headaches can feel like a constant pressure around the temples, a tight band across the forehead, or a dull throbbing that lingers for hours. They often appear within the first days or weeks of treatment as your brain adjusts to changes in serotonin, the chemical messenger that Lexapro increases to help regulate mood. Serotonin doesn't just influence emotions. It also plays a role in blood vessel function and pain perception, which may explain why some people's heads start to ache when their serotonin levels shift. Some headaches improve on their own as your body adapts, but for others they persist for months if not addressed. Lack of proper hydration, poor sleep, caffeine withdrawal, or skipping meals can make these headaches worse. Stress and muscle tension in the neck or shoulders can also be contributing factors. To manage them, start with the basics. Drink enough water, keep a consistent sleep schedule, and eat balanced meals throughout the day. Gentle stretching, neck massages, or relaxation exercises can also ease tension-related pain. Over-the-counter pain relievers like acetaminophen or ibuprofen may help occasionally, but it's important not to overuse them, as frequent use can cause rebound headaches. If you notice your headaches are getting worse, lasting longer, or accompanied by other symptoms such as vision changes, dizziness, or nausea, contact your healthcare provider. In rare cases, headaches can be a sign of more serious conditions like high blood pressure, low sodium levels, or even serotonin syndrome, all of which require immediate medical evaluation. While persistent headaches on Lexapro can be frustrating, they're often manageable with small lifestyle adjustments and guidance from your doctor. The key is to address them early before they start interfering with your ability to focus, work, and enjoy daily life. 2. Jaw clenching and teeth grinding. Bruxism. One of the lesser-known but surprisingly common side effects of escitalopram is bruxism, the involuntary clenching or grinding of your teeth, especially during sleep. People often first notice it when they wake up with jaw soreness, headaches near the temples, or increased tooth sensitivity. In some cases, a partner may be the one to point it out after hearing the grinding noises at night. This side effect is believed to be linked to how escitalopram alters serotonin and dopamine levels in the brain. While serotonin helps improve mood, an imbalance with dopamine, a neurotransmitter involved in muscle control, can lead to excess muscle tension, particularly in the jaw. Over time, bruxism can cause significant dental problems, such as enamel wear, cracked teeth, gum recession, and even changes in your bite. The constant tension can also strain the temporomandibular joint, TMJ, leading to chronic pain or difficulty opening the mouth fully. Daytime jaw clenching is also possible, often happening during moments of concentration, stress, or anxiety. If you suspect bruxism, the first step is to bring it up with your healthcare provider. They may adjust your Lexapro dosage, change the timing of when you take it, or consider switching to another medication. A dentist can also help by fitting you with a custom night guard to protect your teeth while you sleep. Lifestyle changes can make a big difference too. Reducing caffeine and alcohol intake may lessen muscle tension, while stress management techniques like mindfulness, meditation, and gentle jaw stretches can help relax overactive jaw muscles. Applying a warm compress to the jaw before bed may also ease stiffness and reduce nighttime grinding. Bruxism might sound like a minor inconvenience, but when left unchecked, it can lead to lasting dental and jaw problems. Addressing it early not only protects your oral health, but also helps prevent a cycle of pain, poor sleep, and stress that can undermine the benefits of your treatment. 3. Loss of appetite and weight loss. While many antidepressants are associated with weight gain, escitalopram can sometimes have the opposite effect, leading to a noticeable loss of appetite and gradual weight loss. This change often occurs within the first few weeks of starting the medication, as your body adjusts to elevated serotonin levels. Serotonin influences not only mood, but also appetite regulation, and in some people, the medication can suppress the normal hunger signals sent to the brain. You may find that meals you once enjoyed are less appealing, that you get full faster, or that you skip snacks without realizing it. In the short term, a reduced appetite might not seem concerning, especially for those who were previously trying to lose weight. However, over time, insufficient calorie and nutrient intake can lead to fatigue, weakened immunity, muscle loss, and even mood instability. Rapid or unintentional weight loss should always be taken seriously, particularly in older adults or those with existing health conditions. There are several strategies to help maintain adequate nutrition while on Lexapro. Setting reminders to eat regular meals, even if you don't feel hungry, can help ensure you get enough fuel. Focus on nutrient-dense foods, lean proteins, whole grains, healthy fats, and plenty of fruits and vegetables to make every bite count. Smoothies, soups, and high-calorie snacks like nuts or yogurt can be easier to consume when your appetite is low. Staying active can also stimulate hunger naturally, while avoiding excessive caffeine or alcohol helps prevent further appetite suppression. If appetite loss becomes persistent or is accompanied by significant weight loss, speak with your healthcare provider. They may adjust your dosage, suggest taking the medication at a different time of day, or explore alternative antidepressants with a lower risk of this side effect. While loss of appetite is not inherently dangerous in the short term, prolonged undernutrition can undermine both physical and mental health, and addressing it early helps you maintain strength and energy while benefiting from the positive effects of your treatment. 4. Emotional blunting. One of the more subtle yet impactful side effects of escitalopram is emotional blunting, a sense of feeling emotionally numb or detached from experiences that would normally spark joy, sadness, excitement, or even frustration. Many people describe it as living life through a fog or behind a glass wall where they can see what's happening but don't fully feel it. This effect is tied to how SSRIs like Lexapro regulate serotonin, a neurotransmitter deeply involved in mood regulation. While boosting serotonin can ease depression and anxiety, it may also dampen the intensity of emotions across the board, muting both negative and positive feelings. Emotional blunting can have real consequences for daily life. Relationships may feel less connected, hobbies might lose their appeal, and important milestones can pass without the same emotional resonance. For some, this detachment brings a sense of relief from overwhelming emotions. For others, it feels like losing a part of their personality, making life seem less vibrant and fulfilling. It can also reduce motivation, since emotions often drive us to take action and engage with the world. If you suspect emotional blunting, the first step is recognizing the pattern and discussing it with your healthcare provider. Sometimes a slight dosage adjustment can restore emotional range without sacrificing the antidepressant benefits. In other cases, switching to a different medication or combining treatment with therapy can help. Cognitive behavioral therapy, CBT, and mindfulness practices are especially useful for reconnecting with emotions and retraining the brain to notice subtle shifts in mood. Outside of medical adjustments, actively seeking out experiences that engage multiple senses can help awaken emotional responses. Activities like listening to music, spending time in nature, practicing gratitude journaling, or even mild physical challenges can stimulate emotional pathways. Surrounding yourself with supportive people and engaging in meaningful conversations can also help bridge the emotional gap. While emotional blunting isn't physically dangerous, it can profoundly affect quality of life. Addressing it early ensures that mental health treatment not only reduces distress, but also preserves the ability to fully experience life's ups and downs. 5. Heart rhythm changes. QT prolongation. Although rare, one of the more serious potential side effects of escitalopram is a change in the heart's electrical activity known as QT prolongation. This occurs when the time it takes for the heart's muscle cells to recharge between beats is extended, which can be detected on an electrocardiogram, ECG. In some individuals, this change is mild and goes unnoticed, but in others, it can increase the risk of dangerous arrhythmias, such as torsade de pointes, which can lead to fainting, seizures, or even sudden cardiac arrest if not addressed. QT prolongation is more likely to occur in people who already have underlying heart conditions, low levels of potassium or magnesium, or who are taking other medications that also affect heart rhythm. Older adults, those with liver problems, or individuals on high doses of escitalopram may also face a greater risk. Symptoms that could indicate a serious heart rhythm issue include palpitations, dizziness, sudden shortness of breath, fainting, or a rapid, irregular heartbeat. If you're starting escitalopram, your doctor may order an ECG before and during treatment, especially if you fall into a higher risk category. They might also recommend periodic blood tests to monitor electrolyte levels, as imbalances can make QT prolongation more likely. To reduce risk, always inform your healthcare provider about all medications, supplements, and over-the-counter drugs you're taking. For most people, the benefits of Lexapro outweigh the risks of QT prolongation, but awareness is key. If you notice any sudden changes in heart rhythm or fainting spells, seek medical attention immediately rather than waiting for symptoms to resolve on their own. Lifestyle factors also play a role. Staying hydrated, eating a balanced diet rich in potassium and magnesium, and avoiding excessive alcohol or stimulant use can help support heart health. While heart rhythm changes are an uncommon side effect, their potential severity makes them one of the most important to watch for. By being proactive and working closely with your doctor, you can ensure that your treatment for depression or anxiety remains safe without compromising your cardiovascular well-being. 6. Memory and concentration problems. Some people taking escitalopram notice that their memory feels less sharp or that they have a harder time concentrating on tasks. This can show up in small but frustrating ways: forgetting names, misplacing items more often, losing track of conversations, or feeling mentally foggy when trying to focus. While these issues are usually mild, they can interfere with work, learning, and daily responsibilities, leading to frustration or even self-doubt. The exact cause isn't fully understood, but it's likely related to how escitalopram affects serotonin levels in the brain. Serotonin is involved not just in mood regulation, but also in various cognitive functions, including attention, memory formation, and processing speed. When brain chemistry changes, certain pathways for concentration and recall may become less efficient, resulting in what many describe as brain fog. Sleep disturbances, fatigue, or emotional blunting from the medication can also contribute to these cognitive changes. For most people, memory and concentration problems improve over time as the body adapts to the medication, but for others, they persist. Tracking when symptoms occur can be helpful. For example, you may notice more difficulties at certain times of the day or after poor sleep. This information can guide your healthcare provider in making adjustments, such as changing the dosage, altering the time you take the medication, or exploring alternative antidepressants with fewer cognitive side effects. There are also practical strategies you can use to support cognitive function while on escitalopram. Keeping a structured daily routine, using reminders and to-do lists, and breaking larger tasks into smaller steps can make memory lapses less disruptive. Regular physical activity, especially aerobic exercise, has been shown to boost brain function, while a nutrient-rich diet with omega-3 fatty acids supports overall cognitive health. Mindfulness practices like meditation or deep breathing can also improve focus and mental clarity over time. If cognitive changes begin to significantly impact your quality of life, it's important to have an open discussion with your doctor rather than simply pushing through. In some cases, a medication adjustment or combination therapy with cognitive behavioral techniques can restore your focus and help you feel mentally sharper again. 7. Severe withdrawal effects if stopped suddenly. Stopping escitalopram abruptly can trigger what is known as SSRI discontinuation syndrome, a cluster of withdrawal-like symptoms that can be both physically and emotionally distressing. These effects occur because the brain has adapted to the steady presence of the medication. And when it's removed suddenly, neurotransmitter levels, especially serotonin, drop rapidly, causing the nervous system to become temporarily unbalanced. The symptoms can vary widely but often include dizziness, nausea, headaches, fatigue, irritability, insomnia, and flu-like sensations. Many people also report what they describe as brain zaps, sudden, brief sensations that feel like electric shocks in the head. Emotional effects can be just as challenging, with sudden mood swings, anxiety spikes, or a return of depressive symptoms. For some, these withdrawal effects are mild and pass within a few days. For others, they can be intense and last for weeks. Certain factors increase the risk of severe withdrawal, including taking escitalopram for an extended period, using higher doses, or having a history of medication sensitivity. Because of this, healthcare providers strongly recommend tapering the dose gradually rather than stopping all at once. A slow, supervised reduction allows the brain's chemistry to adjust at a manageable pace, greatly reducing discomfort. If you find yourself needing to discontinue escitalopram, whether due to side effects, switching medications, or completing treatment, it's crucial to work closely with your doctor to develop a safe tapering plan. They may also suggest supportive strategies during the transition, such as scheduling rest periods, staying hydrated, engaging in light exercise to boost mood and circulation, and practicing relaxation techniques to manage anxiety or irritability. While withdrawal effects are temporary, they can feel overwhelming in the moment. The good news is that with proper medical guidance, most people can reduce or avoid these symptoms entirely. The key is never to make sudden changes to your medication on your own, no matter how well you may be feeling at the time. Your mental health journey is best supported by gradual adjustments and professional monitoring, ensuring both your emotional stability and physical comfort during the process. Escitalopram, or Lexapro, can be a life-changing treatment for depression and anxiety. But like all medications, it comes with potential side effects that are important to recognize. In this video, we've explored 7 lesser-known yet impactful effects, from persistent headaches and jaw clenching to emotional blunting, heart rhythm changes, memory issues, and the challenges of withdrawal if stopped suddenly. While these reactions may not occur in everyone, understanding the possibilities empowers you to act early, protect your health, and work more effectively with your healthcare provider. If you're taking Lexapro and notice any of these symptoms, don't panic, but don't ignore them either. Keep a record of what you experience, talk to your doctor about your concerns, and explore adjustments or alternative treatments if necessary. Simple lifestyle changes, combined with medical guidance, can often make a big difference in reducing side effects while preserving the benefits of your medication. Your mental health journey deserves both safety and success. If this information was helpful, give this video a like, share it with someone who might benefit, and don't forget to subscribe to MediMint for more trustworthy, easy-to-understand health insights. Together we can stay informed, stay healthy, and make smarter choices about our care.